my session today about the sciatic nerve. You'll see the sciatic nerve origin from L4, L5, S1, S2, and S3. You see this is the piriformis muscle. The nerve emerges under the piriformis muscle and go to the posterior compartment of the thigh. You see here, this is the muscle. This is the biceps femoris muscle, have two heads. This is the long head and this is the short head. And this is the semitendinosus and semimembranosus muscle. So the nerve is in between these three muscles named hamstring muscles. You see here the muscular branch of these muscles. This is the muscular branch to the biceps femoris. This is the muscular branch to the semitendinosus and to semimembranosus muscle. This is the major branch to hamstring. You see it's very clear. This is one. And you can see the vasa nervosa of the nerve. It's very clear here. Now you see the sciatic nerve emerge as one component, and when we reach to the popliteal fossa, this is the apex of the popliteal fossa. It's bifurcated to the two major components. This is the tibial nerve, and this is the common peroneal nerve. The tibial nerve, this is the most medial one. The popliteal fossa, the tibial nerve, gives the sural nerve. You will see the sural nerve. This is the sural nerve. I will mention later the continuity of the sural nerve. In the popliteal fossa, the common peroneal nerve gives this branch called peroneal communicating nerve. The peroneal communicating nerve joins the sural nerve, which comes from the tibial, to form the common sural nerve. It's the same. Now I will follow the tibial nerve after give the sural nerve. As I mentioned here, the tibial nerve continue here, and the early muscular branch to the gastrocnemius head given in the popliteal fossa, and another muscular branch, big one, given to the soleus muscles, and then continue at the border of the soleus muscles and go deep and continue with the bone. I can see the nerve here. This is, you see, it is accompany the posterior tibial artery. This is the tibial nerve, and this is the vessel, is the posterior tibial artery, and continue to the with the soleus muscle and come here. You can see the vessels here. This is the vessels of the posterior tibial artery, and the nerve here go lateral to it. This is the tibial nerve, and here give two branch, medial plantar and lateral plantar, which is go deep and emerge on this side. It's not clear in this part. Now I will follow the common peroneal nerve. As I mentioned, the common peroneal nerve here give the communicating branch, communicating peroneal nerve, which joins the sural nerve of the tibial. And here, this the communicating peroneal branch give branch, cutaneous branch. It is lateral cutaneous of the calf, which supply the calf, the skin of the calf, and continue with the communication with the sural nerve as a common sural nerve to supply the lateral malleolus and the fifth metatarsal. The common peroneal nerve here, the fossa, give the muscular branch. This muscular branch supply the tibialis anterior muscle and continue here to the lateral head of fibula, and here divide into the superficial peroneal and deep peroneal. The superficial peroneal nerve, see here, it's passed between the peroneus longus and the previous, supply both muscle and continue here emerge to the deep fascia of the leg and supply the dorsum of the foot, and see there is multiple branch which supply the dorsum and the back of the foot, and the solar nerve only supply the fifth metatarsal tooth. We have the section of the sciatic nerve anatomy. We will see for gastric five caliber. We will see the 5 variation of the sciatic nerve with cutaneous nerve and solar nerve in each for a 5 caliber. We start by this caliber. You will see here the sciatic nerve divided here, bifurcation to the 2 components, the tibial branch, tibial nerve, which is the medial one, and the common peroneum, which is the lateral one. Now we follow the tibial nerve. We will see here the tibial nerve give the sural nerve. This is the sural nerve, and give here muscular branch to the 2 head of gastrocnemius muscle and also to the soleus muscle. The common peroneal nerve here give the peroneal communicating branch. You will see at the crease of the popliteal fossa the 2 cutaneous nerve, the communicating peroneal nerve and the sural nerve just joined here just below the crease by 1 cm to form the sural nerve. We follow the sural nerve here. We will see the sural nerve go to the lateral aspect of the foot and supply the 5th metatarsal area. It's cutaneous sensation. Here the common peroneal nerve go to the lateral aspect of the head of fibula and go deep, divide into the superficial and deep peroneal nerve. You can see here the superficial peroneal nerve come to the lateral of the ankle and supply the medial of the big toe, and give a branch here to the 2nd and the 3rd and the 4th toes. So now see the bifurcation. This is the popliteal fossa. This is the apex of popliteal fossa, and the bifurcation just above the apex of popliteal fossa. The variation here, the early communicating between the sural nerve from the tibial and peroneal communicating nerve of the common peroneal to form the common sural nerve in proximal leg just below the crease. Now we start by another one. See, this side is very clear. This one. This is the common peroneal nerve. This is the tibial nerve. We see the sural nerve. This is the sural nerve. Continuity here. And the communicating branch cut in this part should become here and join like in this side from early, just in the popliteal fossa, and communicate to the sural nerve. This is the typical one. This is a muscular cadaver. We will see this is the common peroneal nerve. This is the tibial nerve. This is the sural nerve. When we follow the sural nerve, this one, this is the sural nerve, and see the communicating branch, communicating peroneal nerve come here from the common peroneal nerve just at the above the apex of the popliteal fossa, and go down and supply the lower leg after join the sural nerve which comes from the tibial nerve at the mid of posterior thigh, and before go to the sural nerve, it's give a branch, lateral cutaneous branch of the calf to supply the lateral aspect of the leg. So in the popliteal fossa, the tibial nerve gives the sural nerve, but the common peroneal nerve gives the communicating peroneal branch just above the apex of the popliteal fossa and go down and join the sural nerve at the posterior limit of the leg, and also give a branch here, lateral cutaneous branch of the calf. Now the last one. The last one. You'll see this is the sural nerve. You see here in the lateral malleolus give multiple branch. So if we have a surgery here, the sural nerve block may not catch all the branch, so go just above or below the mid posterior of the leg to block the nerve. Also follow the sural nerve. You can see the sural nerve here come from the tibial component. This is the tibial nerve. Here the bifurcation of this cadaver, you will see it is just emerging from the piriformis muscle. You will see two components. This is the tibial nerve. This is the common peroneal nerve. You will see here there is muscle to hamstring, to the long and short head of semitendinosus and to semimembranosus, and also muscular branch to the biceps femoris. You will see the tibial nerve continue here to the popliteal fossa, and here give the sural branch and give also muscular branch to the two heads of the gastrocnemius muscle. See the continuity of the sural nerve here, and the sural nerve here received a branch. It's peroneal communicating branch which comes from the common peroneal nerve. This is the common peroneal nerve. Give here peroneal communicating branch, and this branch continue to join the sural nerve and give lateral cutaneous branch of the calf, and continue here to the lateral head of fibula to be divided into the superficial and deep peroneal nerve. You will see the superficial peroneal nerve between the peroneus longus and the previous, and here the superficial peroneal nerve. You see the branches of the superficial peroneal, the biggest one to the fourth metatarsal, supply the medial and lateral part of it, and this branch to the medial and lateral part, and there is one branch go to the big toe. This is the one. Okay. The width in between big toe and the second come from the deep peroneal nerve. The deep peroneal nerve here, see it's very clear. Here, it's accompany the anterior tibial artery, and here you can see it's reached to the medial aspect of the second toe, and also give a branch to the lateral aspect of the big toe. Okay. Okay. Here you see as I mentioned, the sural nerve here give many branch and go to the fifth metatarsal. So we can see many variation now in the sciatic nerve. Here the early bifurcation just emerge the nerve from the piriformis muscle, but in this cadaver you will see the bifurcation start just in the apex of the popliteal fossa. This is the popliteal fossa, and this is the apex of the popliteal fossa, and this is early bifurcation, but inside the popliteal fossa also this is above the popliteal fossa bifurcation. You can see this. This is the popliteal fossa, and this is above the apex, and also this it's above the apex of the popliteal fossa at the posterior midthigh. The most common variation you can see in all these cadaver, 4 or 5 cadaver, is in the cutaneous branches. So that's why many anesthesiologists give a block, sciatic nerve block, but the patient still feels sensation in the skin incision. because the variant supply of the skin by the sural nerve and the communicating neuronal nerve. From this side, it is like a typical one. The common neuronal nerve give neuronal communicating branch accompany the sural nerve come from the tibial nerve to form the sural nerve. So if we block the sciatic nerve in this side, in the popliteal fossa, or here, we can block all the nerve and it's continuous. But they are the same. We have common neuronal nerve with the branch. This is the sural nerve communicating. This is the sural nerve communicating the branch. Here it's not found in this cadaver. On this side found, on this side, you see the communicating branch come from the proximal part of the popliteal fossa to join the sural nerve, which comes from the sciatic nerve to supply the lateral aspect. Here in this cadaver, it's the most typical one. You see the communication between the sural nerve, the major branch, which is coming from, this is one, this is the sural nerve, this is common sural nerve, this is the sural nerve, which come from the tibial component, this is the tibial nerve. So if we block the sciatic nerve in the popliteal fossa, we can block the sural nerve with it also, and the only reserve is the communicating peroneal branch which join the sural nerve here. It's come from proximal. So the recommended block for the foot surgery, it's from the popliteal fossa, but any surgery just proximal to the ankle should block from the posterior mid thigh or subgluteal to catch all the cutaneous nerve. Here in this cadaver also you see the common peroneal nerve. Here go to the lateral and see the late branch of the common peroneal communicating. See the communicating peroneal branch go with in the area of the popliteal fossa, and here give the lateral cutaneous of the leg and of the calf, and this is the communicating peroneal, which is accompany the sural nerve. The sural nerve here also come in the popliteal fossa. This is the typical one for the popliteal fossa sciatic approach for sciatic nerve, because if we put the probe here and to block the sciatic nerve in two components, we will block all cutaneous branch in this level. But in this patient, as you see, the early bifurcation come from just in the gluteal area, just below the piriformis muscle. So if we need to block the tibial and peroneal common peroneal nerve, we will block it individually, each separated, and the cutaneous branch also will block because it's so distal branching off.